represents a significant risk for those who traverse environments of extreme pressure changes. Its roots lie in the very laws of physics that govern gases and fluids, and its effects range from mild discomfort to life-threatening complications. Understanding decompression sickness requires an appreciation of the delicate balance between pressure, gas solubility, and the human body's intricate biological systems. At the core of decompression sickness is the behavior of gases under pressure, particularly nitrogen. As our body's sea level exists in equilibrium with the atmosphere around us. Every breath we take contains roughly 78% nitrogen, a gas that's physiologically inert under normal conditions. It dissolves into our bodily tissues in proportion to the pressure exerted upon us, as dictated by Henry's law, which states that the amount of gas dissolved in a liquid is directly proportional to the pressure exerted on that gas. When a diver descends beneath the surface of the ocean, the ambient pressure increases dramatically. At just 10 meters, roughly 33 feet, below the surface, the pressure doubles to 2 atmospheres, and with every additional 10 meters, another atmosphere is added. As a result, the partial pressure of nitrogen in the lungs rises, forcing more nitrogen to dissolve into the bloodstream and diffuse into the tissues. This process, under controlled conditions, isn't inherently harmful. Trouble arises when the pressure decreases too rapidly, as in an uncontrolled or rapid ascent from a dive. If a diver ascends too quickly, the dissolved nitrogen in their tissues is no longer kept in solution by the external pressure. Instead of diffusing out slowly through the lungs, it comes out of the solution explosively, forming microscopic bubbles within the tissues and bloodstream. This phenomenon is akin to opening a carbonated beverage after shaking it. The sudden drop in pressure leads to the rapid formation of gas bubbles that were previously dissolved. The effects of these nitrogen bubbles on the body vary widely depending on their size, location, and quantity. One of the most common manifestations of decompression sickness is joint and muscle pain, hence the term the bends. These bubbles often lodge in synovial joints, where they cause inflammation, irritation, and significant discomfort. In milder cases, this pain may be transient, but in more severe instances, it can result in long-term joint damage due to necrosis or tissue death. However, decompression sickness isn't confined to the musculoskeletal system. When nitrogen bubbles enter the bloodstream, they can act as emboli, gas blockages that disrupt circulation. If these bubbles lodge in the small vessels of the brain, the consequences can be catastrophic. Neurological decompression sickness can manifest as dizziness, confusion, visual disturbances, seizures, or even loss of consciousness. If left untreated, the damage to neural tissue can become permanent, leading to cognitive deficits or paralysis. The spinal cord is particularly vulnerable. Nitrogen bubbles within the spinal vasculature can lead to ischemia, or a lack of oxygenated blood reaching critical areas of the nervous system. This can result in symptoms ranging from tingling and persistent cough as blood oxygenation is compromised. In extreme cases, pulmonary decompression sickness can lead to respiratory failure, making immediate treatment absolutely imperative. If left untreated, the body's response to decompression sickness can be just as dangerous as the bubbles themselves. The inflammatory cascade triggered by nitrogen emboli can exacerbate tissue damage, leading to swelling, vascular leakage, and further obstruction of blood flow. In severe cases, this inflammatory response can trigger disseminated intravascular coagulation, a condition in which widespread clotting occurs throughout the vascular system, potentially leading to organ failure. But even beyond the acute phase, decompression sickness carries long-term risks if not properly managed. Chronic forms of the condition, known as dysbaric osteonecrosis, result from nitrogen-induced damage to bone vasculature. Over time, this can lead to joint collapse, chronic pain, and severe mobility issues. Divers who experience repeated bouts of decompression sickness, particularly those who fail to adhere to safe ascent procedures, are the ones at the greatest risk of this condition. The danger isn't confined to deep-sea divers. High-altitude aviators, astronauts, and even individuals exposed to pressurized environments, such as caisson workers in underwater construction, are all vulnerable. In these cases, rapid decompression due to cabin depressurization or exposure to vacuum conditions can lead to an equally severe form of decompression sickness compounded by hypoxia, oxygen deprivation. The combination of nitrogen bubbles and low oxygen levels can make survival difficult without immediate intervention. So, now that we've explored the causes and consequences of decompression sickness in detail, we're going to turn our attention to the critical question of treatment and prevention. While decompression sickness can be devastating, it's not without solutions. Modern medicine and a deep understanding of gas physics provide us with effective ways to mitigate its effects, recover from its symptoms, and most importantly, prevent it from even occurring in the first place. The cornerstone of decompression sickness treatment is hyperbaric oxygen therapy, or HBOT. This is a medical intervention that utilizes a controlled high-pressure environment to safely eliminate nitrogen bubbles from the body. The principle behind HBOT is pretty simple. By placing the affected individual in a hyperbaric chamber and gradually increasing the ambient pressure, the bubbles that form during decompression are reduced in size and redissolved into the bloodstream. Once pressure is stabilized, the patient breathes pure oxygen, which replaces nitrogen in the tissues and facilitates its safe elimination through respiration. This process mimics a slow and controlled descent, allowing the body to off-gas nitrogen in a gradual and non-dramatic manner. Hyperbaric chambers have saved countless lives, but their effectiveness is time-dependent. The sooner a patient receives HBOT after the onset of symptoms, the greater the likelihood of a full recovery. Delays in treatment allow nitrogen bubbles to continue damaging tissues, and in severe cases, Hydration is also essential. Dehydration exacerbates decompression sickness by reducing blood volume and increasing the likelihood of bubble formation. IV fluids are often administered in severe cases to ensure adequate circulation and organ perfusion. In addition to treatment, prevention remains the most effective strategy against decompression sickness. Decades of research and real-world experience have led to the development of strict dive tables and algorithms designed to guide divers in safe ascent procedures. These tables dictate the maximum allowable time at various depths and the necessary decompression stops required before surfacing. By following these guidelines, divers can ascend at a controlled rate, allowing nitrogen to gradually diffuse out of tissues without forming dangerous bubbles. Advancements in dive technology have further refined our ability to prevent decompression sickness. Dive computers, which continuously monitor depth, time, descent rate, provide real-time feedback to divers, ensuring they remain within safe limits. These devices calculate individualized decompression schedules based on a diver's profile, accounting for factors such as dive duration, depth, and previous dives within a given time frame. For technical and deep divers, gas mixtures such as nitrox and oxygen-enriched blend help reduce nitrogen absorption, lowering the risk of decompression sickness. In extreme cases, helium-based mixtures like Trimix are used to further reduce nitrogen exposure. Another critical aspect of prevention is proper acclimatization. Divers who plan repetitive or deep dives need to allow sufficient surface intervals between excursions to permit nitrogen to off-gas fully before re-exposure to increased pressure. Similarly, individuals traveling to high altitudes after diving need to be cautious. Flying too soon after a dive, when nitrogen levels in the body are still elevated, can trigger decompression sickness due to the reduced atmospheric pressure in an airplane cabin. This is the reason why divers are advised to wait at least 12 to 24 hours before boarding a flight, depending on the depth and duration of their dives. Yet, despite all these precautions, human error and unpredictable physiological responses mean that decompression sickness still occurs. Certain factors increase individual susceptibility, making some people more vulnerable than others. Age, body composition, hydration levels, and overall fitness all play a role in how effectively a person processes nitrogen. Fatty tissues, for example, absorb and retain more nitrogen than lean muscle, making individuals with higher body fat percentages more susceptible to decompression sickness. Dehydration, which thickens the blood and impairs circulation, increases bubble formation, while inadequate physical conditioning can exacerbate symptoms. Beyond the physical aspects, the psychological component of diving safety can't be ignored. Divers who succumb to panic, overexertion, or the urge to surface quickly are at greater risk of violating decompression limits. Proper training, discipline, and adherence to established safety protocols are vital in preventing not only decompression sickness, but also the many hazards associated with diving. For astronauts and high-altitude aviators, the principles of decompression sickness prevention remain largely the same, though the execution differs. In spaceflight, pre-breathing protocols involving extended oxygen exposure help reduce nitrogen saturation before extravehicular activity in the vacuum of space. Similarly, high-altitude pilots wear pressure suits that maintain stable environmental conditions, preventing the rapid decompression that can lead to nitrogen bubble formation. Ultimately, decompression sickness serves as a reminder of the delicate balance within our bodies and the forces of nature that govern our biology. The human body wasn't designed for extreme changes in pressure, but through science, training, and discipline, we've learned to navigate these environments safely. For those who explore the depths of the ocean, the heights of the atmosphere, or the vastness of space, understanding the risks and respecting the principles of decompression is not just a matter of knowledge, it's a matter of survival. So let's remember that while decompression sickness is a formidable challenge, it's one we can overcome with vigilance and preparation. Whether you're a diver exploring the wonders of the deep, a pilot soaring through the skies, or an astronaut